All right. I don't really want to spend my time on this channel too much ripping on other YouTubers, but a very big YouTuber who's a chiropractor named Dr. Berg recently released a video on ADHD, and there's a lot of hogwash in it, and some of it is pretty gosh darn dangerous, not to mention just categorically not true. Let's dig in. Hi out there, this is Dr. Pearce, child psychologist, and today we are coming at you with a critique of a video posted by major YouTuber Dr. Berg, who is a chiropractor. Nothing against the fact that he's a chiropractor, but I do not know what training in behavioral health that chiropractors have. I don't know what his knowledge of behavioral health is specifically, but it can't be too good because there are several things in his recent video on ADHD in which he talks about the nutritional component of it, which I'm not necessarily opposed to. But at any rate, yeah, there are some serious problems with what this guy is saying in his video. So let's begin. First of all, Dr. Berg says that in his view, it is not a mental disorder. Okay, I'm glad he said that it's not in his view, because ADHD is in the DSM-5, which is to say it is a behavioral health disorder, and it's specifically classified as a neurodevelopmental disorder. And other kinds of neurodevelopmental disorders are things like autism, intellectual disability, learning disability, speech and language disorders, etc. It would not surprise me to find out that there's some sort of nutritional component or that certain nutrients help. None of that would surprise me in the least. But it is a behavioral health disorder through and through. The second big thing that Dr. Berg says in his video, which made me laugh out loud with shock and astonishment, frankly, is that ADHD is not genetic. I'm sorry, but it's just almost like a joke. I mean no disrespect, but I don't know how else to say it. ADHD has been studied extensively, and he cited like one study for a disorder that has been studied extensively for decades. Not only does ADHD run in families, indicating a clear genetic component, but at least as of information I was provided a few years ago, we have started to identify specific genetic markers for ADHD. It has been studied extensively, and it just feels like Dr. Berg, I don't know, maybe got some requests to talk about it or was thinking about it or something, and so he took an entire field and a very complex disorder from that field and then boiled it down to one recent study that looked at the thrust of his video, which is on omega fatty acids. Now, I'm not here to say yes or no to that. I do know that omega fatty acids have been studied in connection with plenty of mental health stuff, such as anxiety, depression, ADHD, and there's a lot of data indicating that omega fatty acid balance is important for lots of parts of your body and can certainly help with things like anxiety, depression, mental clarity, and things like that. So it doesn't surprise me to find out that folks with ADHD experience improvement in a good way, not improvement in their symptoms. You know what I'm trying to say. Like it's beneficial to them to get a proper omega-3 fatty acid balance to other omega-3 fatty acids. In fact, I can't really recommend that in a video because, I'm not a medical professional, I'm a mental health professional, but I myself personally take cod liver oil and often fish oil just for that exact purpose. But as someone who worked for an ADHD clinic for several years, and as a child psychologist in general, I work a lot with ADHD, there is a lot that's the matter with this video. Folks, kids with ADHD can struggle with a lot of problems. The best established treatment for ADHD is medication. And he makes just this almost like ad hominem joke attack on Ritalin, which is to say stimulant class medications, which are the recommended treatment for ADHD for a very specific reason that has to do with brain balance. Effectively, the idea is that several areas of the brain with ADHD are hypoactive, which is to say they're underactive, And stimulant medication helps to rebalance that. It doesn't do a perfect job of it. It also could be that we'll find better treatments. There's other treatments too out there, like something called neurofeedback, which is almost like a computer-guided meditation that we won't get into, but there's some research out there to indicate its effectiveness. But I have seen kids who are struggling dearly, and this is coming from someone who's conservative about diagnosing ADHD because it is overdiagnosed. But I have seen kids who legitimately have ADHD struggle dearly for years to then get put on the right stimulant class medication by either a psychiatrist or a nurse practitioner or their pediatrician to then do almost a 180 in terms of improving things. Some kids with ADHD, particularly hyperactive and restless and impulsive symptoms, can even struggle with dangerous issues such as bolting in front of cars impulsively, instant reactive aggression that can be dangerous to themselves and others. Kids with ADHD are also more vulnerable to developing anxiety and depression for lots of different reasons that are beyond the scope of this video. But Dr. Berg makes it look like this entire intense, complex disorder that can have a severe impact on people's lives, that if you just take fish oil, then you're gonna be okay. Oh no, sorry. If you've got ADHD or your kid has ADHD, by all means, take a look at any nutritional recommendations made by, appropriately credentialed professionals and things. That sounds wonderful to me. And if it's of benefit, great. But absolutely go see a mental health professional so that appropriate therapy can be given, because folks with ADHD and kids with ADHD very often need a lot more therapy than other folks, because it takes a lot of repetition and practice and patience to learn new skills, because that's one of the hallmarks of ADHD, which is to say difficulty benefiting from natural consequences in the environment, even, not natural, like ones levied by other people. And there's a substantial chance too that medication could be of a lot of benefit. And this is coming from someone who, as a child psychologist, is conservative about diagnosing ADHD and can be conservative about making referrals for medication in many situations. So I don't know where you're coming from, good sir, Dr. Berg, but I consider your video to be misleading at best and dangerous at worst. Please, the next time you want to talk about a mental health disorder, you might consider having a mental health professional who knows about the subject appear on your video with you so that appropriate information can be given to the public. Thank you. Take care.